So is the medical community satisfied with these new measures in Ontario? Dr. Allison McGeer is infectious disease physician and a senior clinician scientist at Sinai Health System. She's in Toronto. And Dr. David Naylor is the co-chair of Canada's COVID-19 Immunity Task Force and professor of medicine at the University of Toronto. He's in Toronto, of course. Hello to both of you.
Hi there.
Good evening.
So I want to start with your reactions to the new restrictions Premier Ford just announced, including 50% capacity limits for all indoor settings. You think these measures go far enough? Dr. Naylor, why don't you start things off?
I think they're important, but I don't think they go far enough, unfortunately. I think we still have mass events at 50%. And I think in other cases, we still have too many people circulating and running into each other. I understand the difficulties in making these decisions, particularly at this time of year. We are all disappointed and fed up with the siege we've been under, and the timing couldn't be worse, but I think those limits are generous given the infectiousness of this variant and the pace at which it's moving. So more needed, I'm afraid, and obviously don't want to be the bearer of that kind of news, but that's the reality.
Dr. McGeer, your thoughts? I mean, this is obviously aimed at making sure the healthcare system isn't overwhelmed. Will this do the trick, you think?
I would agree with Dr. Naylor. I don't think it's enough. It's a very good start. It may be the most that the government thought they could reasonably expect of people today, just given how, disappointed and discouraged everybody is about being in this situation. But really, I think as Dr. Brown said yesterday from the science table, what we need is a circuit breaker.
You're right, though, to talk about how it's tough news for people, isn't it? And it's tough. We're all exhausted. We've been saying this all, as Omicron has I want to say crept toward us, but it's racing toward us now, it feels. The key question here seems to be how to motivate people to follow these, call them guidelines, call them regulations, call them advice, whatever it is. How do you convince people, as bad as this is, that it's got to be done? Dr. Naylor, why don't you begin that one? It's a tough one.
I think that Canadians have risen brilliantly to the occasion for the last, almost 2 years. Politicians have been up and down. Canadian social solidarity and sense of compliance and ability to keep doing the right thing has been absolutely fantastic. I think one simply has to ask them to do it again. I do think we are getting near the end of the line with this virus. I have a fair bit of optimism about how things will go after this particular variant has its day sweeping through countries, and as we head towards better weather. But I think we've got a tough couple of months ahead, and we just have to ask the public in collective self-interest to bear down and put up with some restrictions that are really not where we were, frankly, in early 2020. These are not back there, but just some measures to slow circulation and put a bit of a hitch in the step of this very fast-moving virus. That's all we can do, I think, Paul.
And Dr. McGeer, I'm sure you must get from your own personal friends coming up to you and saying, here we go again. Really? Must I? How do you motivate people on this? As serious as it is, right?
I really think it's just an element of time. The problem with this virus is that it's moving so quickly that everybody's just a little shell-shocked, and it's sometimes you have to hear things more than once to really appreciate the depth of it. And you've watched our government move, very quickly, but still in steps over the last couple of days. And that's just, to me, how long it takes for people to say, oh my heaven, look at how bad this is. And so we need to get everybody there to be able to see what the data are telling us and to understand where we're going. Once you're there, yeah, it's bad. But as Dr. Naylor said, once we can all see it and we know what we need to do, I don't have any doubts that Canadians will do it. It's just a question of going from we were doing so well into we need to make a lot of changes that we don't want to make in 6 hours is really hard to do.
You know, you talk about timing. The other factor, of course, right now is that not only is it here we go again, but we're coming up to the holidays. It's like it's all happening at once. But then the next thing people will start to think once, as you say, once it starts to soak in and people say, okay, we got to suck it up and do it. The next thing down the calendar is whether schools will, reopen after the holidays and when that might happen. Premier Ford said today no decision has been made on whether schools will reopen in the new year. Dr. Naylor, what do you think the province is considering on this? What's it weighing right now?
I think it has to weigh the reality that everyone agrees that schools should ideally be open, that kids do better in school, that it's vital to try to get kids together with teachers in the classroom setting. And then set against that is the reality that, well, we've got some first shots into some of these younger kids. There's a whole bunch of them who either haven't had a first shot or others, again, large numbers, who are waiting for a second shot. And so the reality is that there is a concern about schools and infection, and I think it's going to be a very tough call for the province and the CMOH to make. And nothing easy here, all pretty sudden, as Dr. McGeer said, and tough decisions ahead.
Nothing easy indeed. I mean, Dr. McGeer, do you think it's even possible to balance keeping schools open while the province deals with Omicron?
I think the answer at the moment is it's too early to tell. It really depends on how things evolve. I think we have agreed in principle that we're going to close schools last. So, I think Ontarians are probably behind that. We know how important school is to children. I think we need to be willing to do everything else up to that, and closing schools should be the very last thing to go. But at the rate cases are increasing, it just may be necessary to close schools at the beginning of January. And only, the next 10 days is going to do it. And I also think because of the uncertainties involved, it's not a decision you want to make before you have to make it, right? It's frustrating as it is for people to need to be able to plan going forward. Really what we want is schools open if we can do it at all. So we need to be able to go forward with that premise and to know that because we're going to try to keep schools open, we almost want to be making the decision at the last possible moment, because otherwise you would look at the situation now and say, well, we're just closing schools now. And we definitely don't want to do that.
One decision that's often not made at the last moment is travel. Federal officials, as you well know, are telling Canadians now is not the time to travel. All international travelers must once again get a COVID-19 molecular test before returning to Canada. I hesitate to ask because I think the answer is it depends, but how much longer do you think Canadians will need to hold off on making travel plans? Dr. Naylor.
We're going to be on the uncertain
Dr. McGeer, go ahead.
Sorry, yeah. As you heard Dr. Naylor say, this is not forever, okay? This is probably the next 2 months. I think it is probably not sensible to make travel plans if you want to be safe until April, but this is not going to go on forever. We are going to get third doses into people. We can get case rates down with public health restrictions. We've done all this before, and we can very definitely do it again. It's just that, in the short term, no matter where you're traveling, travel increases the number of contacts you have, and how close you get to people, and it very definitely facilitates the spread of COVID. And so any travel that you can cancel will help us save our healthcare system.
Last word to you, Dr. Naylor.
Yeah, I'd just say that, as between having higher capacity limits in some recreational facilities and trying to make sure the case counts are kept down so schools can stay open, boy, I'd put the kids first, much as we all like our outings and our time together. It's just important to think about keeping those schools protected, and as Dr. McGeer said, to wait and see, but do all we can to contain this for them, if no one else, obviously for all of us together. The other point on travel, pretty clear cut. just a bad time to be traveling. Terrible time for this flare-up to happen in terms of the travel people want to do to see loved ones abroad. Obviously, travel in Canada is going to be a lot more limited now, so terrible timing, but I am very confident we can get through this, and we just need to keep the case counts down, try to keep the toll down, keep our healthcare system functioning, set things up so we can get our kids back to school. This will pass, but right now, timing's terrible, very disappointing, but we need to bear down, I hope, one last time.
Strong advice from both of you. I appreciate your thoughts. Thank you.
A pleasure.
Dr. Allison
Take care.
McGeer.
Bye-bye.
Thank you. And Dr. David Naylor.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.